Welcome to Easy Physiology and Research Pro. What happens when the body's finely tuned internal balance, what we call homeostasis, is suddenly pushed to the edge? In today's video, we dissect a real-life scenario that puts every homeostatic system to the test. Get ready to challenge your clinical reasoning with a dynamic, MCQ-driven case that brings textbook physiology to the bedside. Here's our patient. A 20-year-old competitive runner collapses midway through a long-distance race on a hot, humid day. He's disoriented, sweating profusely, and breathing rapidly. His blood pressure has plummeted, and his body temperature is dangerously high. Let's look at his vitals and lab values, and start piecing together what's going wrong. This is more than just simple dehydration. Ask yourself, what triggered the collapse? Which systems failed to compensate? And how does this tie back to the broader concept of homeostasis? From thermoregulation to glucose balance, nearly every system is under stress. Notice the interplay. Low sodium, low potassium, low glucose, combined with hypotension and hyperthermia. It's a multi-system crisis, and an incredible opportunity to explore integrated physiology. Let's break down the body's attempts to restore balance. The hypothalamus tries to cool him through sweating. Baroreceptors detect the drop in pressure and activate the RAAS. ADH kicks in to conserve water. And the sympathetic nervous system ramps up to maintain perfusion. This is homeostasis in full action, until it's overwhelmed. Despite initial intervention with fluids and cooling, things get worse. The athlete now has muscle cramps, worsening confusion, and scant urine output. This is no longer a simple collapse, it's the early phase of hypovolemic shock. Cellular metabolism begins to fail. Tissue perfusion is inadequate. Anaerobic metabolism builds up lactic acid. We're staring at the very mechanisms of systemic decompensation, from inside out. Let's test your understanding with 10 high-yield, case-linked MCQs. Take your time, reason through each one, and comment your answers below. Which mechanism was primarily responsible for the increased heart rate? Consider all the options very carefully. Which hormone would be elevated? ANP, ADH, insulin, erythropoietin. This is an easy guess. Why is sodium low despite dehydration? Recall the mechanisms of sodium balance maintenance. How does the body correct hypoglycemia? A. Positive feedback via insulin. B. Negative feedback via glucagon and cortisol. C. Positive feedback via epinephrine. D. Autonomic afferent feedback. What senses the BP drop first? The questions is asking which system primarily detects the fall in blood pressure. A. Osmoreceptors. B. Peripheral chemoreceptors. C. Baroreceptors in carotid sinus and aortic arch. D. Juxtaglomerular apparatus. Recall these mechanisms. Where does the thermoregulation begin? Recall and answer the question. The thermoregulatory response initiated by sweating is triggered by A. Peripheral thermoreceptors only. B. Hypothalamic osmoreceptors. C. Hypothalamic preoptic nucleus. D. Heat-sensitive nociceptors. What causes the muscle cramps? Check the metabolites homeostasis. A. Hypercalcemia. B. Hyperkalemia. C. Hypokalemia and electrolyte loss. D. Elevated lactate levels. Which transport helps ADH action? A. Primary active transport. B. Osmosis via aquaporins. C. Facilitated diffusion of sodium. D. Endocytosis. Why is urine output low? A. Decreased sympathetic tone. B. Vasodilation of renal afferent arterioles. C. RAAS-mediated sodium and water retention. D. Inhibition of aldosterone. The question asks which acid-base change is most likely in prolonged heat exhaustion. The four options are: A. Respiratory acidosis. B. Metabolic alkalosis. C. Metabolic acidosis. D. Respiratory alkalosis. It's important to understand the mechanisms of how the body regulates acid-base balance in order to correctly identify the most likely change in this clinical scenario. Answers and detailed explanations will be shared in a follow-up video once we hit 25 quiz attempts, so be sure to participate. The diagnosis? Heat exhaustion with evolving hypovolemic hyponatremia. The solution? Timely isotonic saline, gradual cooling, and glucose support. Swift action, based on physiological insight, made all the difference. This case reminds us that homeostasis is never about one system, it's integration. Small physiological imbalances can snowball fast. Time is the most critical factor in saving a collapsing patient. Now it's your turn. Map each symptom in this case to a homeostatic response. Drop your answers in the comments. And if you found this valuable, like this video, comment your doubts or diagnosis. Subscribe to stay tuned with our application-based clinical series. Let's master medicine, one case at a time.